areas and problems that the elderly are struggling with when I visit them as a deacon are mobility, decreased mobility. In terms of mortality, I don't hear a lot of people talking about fear of death. When frequently, when the person I'm visiting brings up the question, it's something usually like, I've lived a long life and I'm ready for when God calls me. But in the meantime, I see that they do have problems with mobility, they have problems with feeling isolated, vision problems. These kinds of things make it difficult and sort of unsafe for some people to be aging in place at home and alone. And I think that by raising up the diaconate and pushing the diaconate, that is a real service that the church can give to the aging community, because one of the bedrock principles of being a deacon in our tradition is to connect the world to the church and the church to the world, so that people who are at home, who've had a long, active life contributing to the life of the church, are not left alone and don't feel isolated. There are several specific issues which are particular to aging in the Black community in this country and at this time. The Black community has real battles with 3 or 4 disease entities. There is a lot of diabetes in the Black community. There is a lot of hypertension, and there is a lot of cancer. Diabetes, I'm sure, is related to poor diet and lack of education around proper foods and exercise. The hypertension is also diet related, but is also related very much to the stressors that Black people still live under in this country, and particularly in the urban environment. And the cancer, I think, has a lot to do with lack of access to medical care, even now, as we speak today, that Black people have, which is not so much a problem in the majority culture. And unfortunately, not enough people in the Black community, professionals who have the expertise to work on these problems, are doing what I consider would be enough. I don't know about a lot of other parishes, but I know that places that I have been associated with have been fortunate to have people from various professions and disciplines that a person such as myself can bring to the priest, problems that we have uncovered, and a priest can go to a parishioner who's a social worker or a psychologist, nurses, to really help and call up people, go visit and do what they can, either themselves or make referrals to agencies. Just as I considered myself a minister as a nurse before I was ordained, I always felt that nursing and the helping professions are by definition ministries. Well, there are people in their 70s and 80s, and if they do marry, they will lose substantial benefits in terms of Social Security and those kinds of things. And I feel that it's a good situation that they work together and build a life together. I think that the church needs to welcome those people. They need to treat them as anybody else who is in a committed, loving relationship. The idea is that they're with each other to love and care for one another, and that's what Christ wants us to do. And they are healthier when they are partnered with someone who is a support for them, or that they have to come out of their own problems in order to be helpful to somebody else. The Episcopal Church definitely needs to help caregivers who are taking care of elderly, ill, distressed family or friends. Again, it's a matter of drawing on the expertise of people around you that you know can offer this kind of help. Their support groups can be set up. Perhaps people can be trained to be sitters so that the caregivers can have an afternoon off at the movies or something like that. People can definitely be trained to do physical care so that maybe someone can go in a couple of times a week to help people to bathe and spell the caregiver. As a matter of fact, I don't know of any structured program within a particular Episcopal church that does these kinds of things. There's a need for it, and those kinds of things can be set up.